Good morning everyone. My name is Jainosh. I'm doing study at Toyoma Institution and my course is Infection Risk Management. My student ID number is 300-23248. Today I'm going to explain about measles outbreak in epidemiology. My topics are critical analysis about measles and outbreak, about the infection disease including specific population and geographical area, and the contribution of epidemiology towards public health strategies to improve population health. Introduction. Measles. It is one of the most infectious disease. Measles categorized under childhood infection and caused by rubella virus and preventable using a vaccine. In the early past, it was a common disease that can be prevented through use of vaccine. And to some extent, it may be severe and fatal for the small children and under 5. It has a varied severity and fatality that depends on the age of infected person. For example, I can say is severe fatal for the small children, mostly under 5 years of age. And death rates from measles have been reducing globally. The death rates are falling. The disease still managed to cost more than 100,000 lives yearly. Most of this death occurs among the under 5s, also who fail to be vaccinated or unsure about their vaccination status. Globally, children get measles vaccine and it approximately kills more than 100,000 lives per year. Description of rubella. The rubella virus comes from the paramyxovirus family. Morbillovirus. The scientific name of the virus is morbillovirus. It is a negative sense virus and has a single strand of RNA. Its gene is capable of encoding 8 proteins. The virus genome is capable of encoding 8 proteins, the complete set of genes or genetic material present in a virus called genome. The virus is transmitted through airborne in droplets from cough or sneezing. It attacks epithelial cell, the virus affects respiratory tract especially. The virus attacks human respiratory tract most of the time. Upper respiratory tract, after the infection, the virus locates in lymphatic tissue for replication. After the replication, in the lymph node, it moves into different body organs such as liver, kidney, and gastrointestinal tract, and even skin. Epithelial and endothelial cells and macrophages, those are the common organ system where the replication occurs. It is capable of accessing respiratory cells where new virions escape after the replication to invert new host. Rubella virus image. Let me explain about the rubella virus image. The first envelope, and this is the protein called hemagglutinin, and the second one is fusin, and the third one is matrix, and the remaining are basic structure, lipid membranes, nucleocapsid, and phosphoprotein, and the last one is large protein, and the final one is RNA. Hemagglutinin, which is responsible for binding of virus to cell. Hemagglutinin is the antigen against which neutralizing antibody is formed. Fusion. Fusion is the protein which is responsible for virus and host cells membranes. Viral penetration and hemolysis. These two proteins are called glycoproteins, which is important for pathogenesis. Matrix is inner layer of the protein. You can see that here this is the inner layer, and this protein play important role in virus assembly. Lipid membranes are group of compounds. It is similar to fats and oil. Nucleoproteins, which is linked to nucleic acid. Phosphoprotein here. Phosphoprotein contain phosphorus. Large protein is responsible for RNA chain activity. Ribonucleic acid, which is called RNA, the last one. Disease pattern in New Zealand. In 2019, 16 out of 20 district health boards reported measles. In 2019, New Zealand reported measles in 16 out of 20 district health boards. Even though most DHP were under control using effective public health intervention, in Auckland cases seen quite multiplication. By the end of the September 2019, Auckland contributed to 80% of countrywide notification about measles. Disease burden is high among infants under 2 years. From the report, highest cases were reported to be infants, especially those who are under 2 years. Disease is moderate among young adults, most so those above 30 years. The disease infants were followed by young adults and teenagers who were categorized under 30 years. Measles is rare among people past 50 years. People above 50 years reflected a lower burden of the disease. And the last one is ethnic distribution. Pacific 36% and Maori 39%. Pacific and Maori people were affected in percentage, which is around 36% to 38%. Characteristic of the population that contributed to outbreak. Most affected population, children under 5 years. Measles are more serious in children below 5 years and adults going beyond 20 years. Infants lacking maternal antibody at birth. The increased susceptibility of clinical measles occur to infants from younger women. Some cases occur to infants due to the fact that their mothers lack maternal antibodies that could protect them against the measles. Infants whose mothers develop measles after delivery. Those mothers who lack maternal antibodies, they can pass to infant during their pregnancy period. Younger adults less than 30 years. The children who lack maternal antibody at birth increase susceptibility to measles. Pregnant women. Most of the pregnant women get affected to measles, which contributed to outbreak. Individuals. Individuals with compromised immune systems such as HIV and leukemia cancer, they also get affected to measles easily. Characteristic of the chosen population, the spread. The characteristic of the population that continues to spread measles in New Zealand include low immunization coverage and recent decrease in immunization coverage and rising equity gaps in infant program. Inadequate or no immunity, they have immunization gap. There are three factors that increase the spread of measles in New Zealand. These factors to some extent revolve around the most affected population in New Zealand. There is a long history of low immunization coverage among teenagers and young adults below the age of 30. The other Pacific and Maori ethnic communities show unknown records of immunization. Secondly, there is a decreasing trend in immunization coverage which eventually increase gap in infant program. The history figures suggest inadequate or total lack of immunity. Public health surveillance and importance. Defined as ongoing systematic collection, analysis and interpretation of health related data. Public health surveillance refers to ongoing systematic collection and analysis and interpretation of health related data vital for planning, implementing and evaluating public health practices. The second one is surveillance is needed for vaccine preventable disease. Surveillance is important in vaccine preventable disease. New Zealand is one of the country that collect data on vaccine preventable disease. It is a public health intervention that highly needed since it serves as an early warning system upon identification of public health emergencies. The third one is surveillance is important to immunization program. It is also provide guidance in health policy and health sector to record impacts of an intervention such as an immunization and its progress towards the target. In New Zealand and other countries, data on vaccine preventable disease are gathered for future reference. Here we are talking about epidemiology. It also monitors epidemiology of a health condition, in this case the epidemiology of measles in New Zealand. Importance of surveillance. Public health surveillance in vaccine preventable condition forms an important and integral component of immunization programs. The second one is it monitors the progress of programs that aim specific target. In a number of countries, there is a provision for collecting data regarding vaccine preventable condition. It is subsequent analysis and feedback obtained to guide program activities. Offers support to surveillance site regarding certain disease. Surveillance plays an important role in monitoring program continuity while aiming specific goals. For example, surveillance on measles control or elimination has been applied in other countries as the backbone of surveillance of other health conditions. The last one is detects disease and ensure that people are notified of health events. The public health surveillance is also capable of supporting surveillance site covering particular health condition. Typical surveillance strategies linked to measles. Establishing a nationwide case-based surveillance. Implementing a case-based surveillance is the best method to find out measles cases. Ensuring early detection of measles. Detecting the cases of the early stage and inform all the healthcare professionals to educate themselves as well as to the public. Adequate investigation. Adequate investigation will help the government to find out the suspected measles cases in all regions. Ferry specimen. Putting in a place sufficient capacity to ferry specimen from suspected case in all region. This will be helpful for them to find out the measles case very easily. And expanding surveillance. Expanding surveillance to other condition linked to measles. EpiCurve on measles. The EpiCurve is summary of measles notification in just a single week starting from 1st January. The EpiCurve data found in New Zealand Ministry of Health website. So let me explain about the EpiCurve now. This is the number of cases starting from 0 to 200, and this is the month starting from 4th January and ending in 14th February, and this is the peak level when the measles went high. This data collected from Ministry of Health. Since January 1, 2019, there has been 2,195 cases across the country. Particularly Auckland and Manuku was hit hardest, accounting for 1,736 of the total cases. The outbreak peaked in the month of September and the number of cases has dropped February 18th. Here you can see the peak level and where it has started from 19th July. According to Institutes of Science and Environmental Research data, in mid-September the cases are around 165 in New Zealand. Here how you can calculate the cases 165, and here you can see the data. And since the outbreak began, 774 New Zealanders required hospitalization due to measles. Most of them are young adults. The government funded $23 million to get them vaccinated. Role of epidemiological data. Measles is targeted for eradication globally. Measles is one of the disease that is targeted for eradication globally, and therefore epidemiological data plays an important role in activity these goals. And lesson learned during polio eradication play an important role. Lesson from other vaccine preventable disease such as polio eradication plays an important and comparative roles to measles. And surveillance network to respond the cases and outbreaks. Surveillance networks have been put in a place to notify and respond to cases and outbreaks. Measles spread is interrupted by vaccination. The epidemiological data reveal that the chain of measles spread is interrupted by vaccination. Goals for measles control and 90% national coverage and 80% in various districts. Global recommendation for measles coverage is 90% at national level and 80% at the district level. These percentages are due to the fact that 100% coverage cannot be achieved. Types of epidemiological studies. There are different type of epidemiological studies. The first one is cross-sectional, the second one is case control studies, third one is cohort studies, and the fourth one is intervention studies. The first one, cross-sectional studies. Useful in public health intervention, it measure the characteristic of a population that would cause an outbreak and spread of measles. The result shows a causative risk factor, only the sample is studied. This is called cross-sectional studies. And the case control studies, these studies entirely focus on determining the causation. A case is an individual with specific symptoms. A focused comparison is done between those who do not have the symptoms. Cohort studies. Cohort studies is a study that focuses on people showing specific attributes or characteristics. Intervention studies. Intervention studies refers these that utilize observation and includes intervening with a group of people. Epidemiology and public policies. Epidemiological research plays an important role in preventing disease and developing public policies. Approach to prevention: primordial, primary, secondary, and tertiary. The first one, primordial. Epidemiological research plays an important role in preventing occurrence of disease. It gives multiple approaches such as primordial, which seek prevention at an early stage. Primary prevention, which focus on controlling risk factors for susceptibility. And secondary, which is introduce recommendation, treatment, and intervention. And tertiary prevention, which seeks to do away with the suffering and disability cases. And health public policies need to be evidence based on content, implementation, and outcomes. On the other hand, public policies that are ongoing from epidemiological research needs to be evidence based. Public policies measures are important in prompting better health as they reduce the exposure to risk factor, such as policies tend to focus on content, implementation, and outcome. Epidemiological research therefore shapes the framework used in designing public health policies. The role of epidemiological research in treatment, prevention, and control in public health, which means community health. The first one, professional involved in preventive medicine use epidemiological research in treatment, prevention, and control public health. Professional involved in preventive medicine use epidemiological research in treatment and prevention and control public health. The second one, epidemiology is sued in disease surveillance. Epidemiology is sued in disease surveillance, disease outbreak investigation, and identification of risk factor to specific disease. And good understanding of these risk factor advanced research investigation. Good understanding of this advanced research investigation. The risk factor knowledge is essential in implementing disease control measures. The risk factor knowledge is essential. In food Production epidemiological research is helpful in designing hazard analysis and critical control points. This is very important approach in identifying and controlling hazard on risk factors, and it depends on the information from epidemiological studies.